Hello friends, welcome to my channel. Today we're going to talk about a very important topic related to health. Anemia. Yes, you heard it right. It's that condition where those red blood cells fail to do their job properly. Now let's take a closer look at this together. Anemia actually means a deficiency in the oxygen carriers in your body. That is, either the number of red blood cells is low or there's a deficiency in hemoglobin protein. As a result, various parts of your body don't receive enough oxygen. And here come the symptoms of anemia into play. Are you feeling excessive fatigue? Are your hands and feet constantly cold? Do you have a pallor in your skin? Have your nails become brittle? Are you struggling to breathe? If you have one or more of these symptoms, it could be a condition you need to pay attention to. The most common type of anemia is iron deficiency anemia. Iron is crucial for the proper functioning of red blood cells. And here is where nutrition comes into play. With a balanced and healthy diet, you can prevent or treat problems like iron deficiency anemia. So, how is anemia treated? Here's where the knowledge and assistance of your doctor come into play. Based on the results of blood tests, your doctor will recommend a suitable treatment plan for you. This could involve medications, iron supplements, or some dietary and lifestyle changes. But remember, it's crucial to consult a specialist first for treatment. Anemia, also known as iron deficiency or lack of healthy red blood cells or hemoglobin in the body to carry sufficient oxygen to organs and tissues. Anemia results in decreased oxygen flow to the body's tissues and organs, leading to various symptoms. Symptoms such as fatigue, pale skin, shortness of breath, dizziness, and rapid heartbeat are considered signs of anemia. Deficiency in critical vitamins and minerals, including insufficient production of red blood cells, can lead to anemia. Anemia is defined as having hemoglobin levels below 130 grams per liter of blood in men, 120 grams per liter in women, and below 140 grams per liter in newborns. Anemia can occur in both men and women with iron deficiency, anemia being more common in young women due to excessive blood loss during menstruation. While anemia can be temporary, it can also be experienced chronically, and its effects can be mitigated with various medications, treatment methods, and nutritional programs. Anemia has four main causes: blood loss, deficiency in red blood cell production, rapid destruction of red blood cells, and deficiency in vitamins and minerals such as iron, vitamin B12, and folate, necessary for the production of red blood cells. Anemias resulting from blood loss are primarily caused by menstrual bleeding in women, gastrointestinal bleeding related to the stomach and intestines, or a decrease in platelets or clotting factors. Lack of red blood cell production can occur due to various chronic diseases, bone marrow cancers, leukemia, and hereditary diseases causing rapid destruction of red blood cells. Additionally, some medications, autoimmune diseases, cancers, pregnancy, infancy, adolescence, and old age are among the causes of anemia. The body requires vitamins such as B12 and folate, B9, as well as minerals like iron to produce red blood cells. Iron deficiency anemia is among the most common causes, as iron is the central component of hemoglobin, which transports oxygen. If there is insufficient iron in the body, less hemoglobin is produced, leading to decreased oxygen transport. Iron deficiency anemia is more common in women than men, and is often caused by excessive menstrual bleeding or inadequate nutrition. Anemia is divided into four types: aplastic anemia, hemolytic anemia, megaloblastic anemia, and pernicious anemia. Aplastic anemia. Aplastic anemia originates from a disorder in the bone marrow. The blood-producing cells in the bone marrow are destroyed by immune system cells. This means that sufficient blood cannot be regenerated. Not only the number of red blood cells decreases, but also the number of other blood cells. Hemolytic anemia. In hemolytic anemia, red blood cells are destroyed before completing their normal lifespan. The bone marrow cannot produce new blood cells in the required time frame, leading to anemia. There can be many causes of hemolytic anemia. Autoimmune hemolytic anemia occurs when the body's own antibodies cause the breakdown of red blood cells. Megaloblastic anemia. This type of anemia results from a disorder in DNA synthesis. It is caused by a deficiency in vitamin B12 or folate, B9. In megaloblastic anemia, red blood cells are produced in lesser amounts but are larger than normal. Pernicious anemia. Pernicious anemia is an autoimmune type of anemia caused by a deficiency in vitamin B12. Vitamin B12 is necessary for blood formation. In the body, vitamin B12 is absorbed in the stomach through a glycoprotein called intrinsic factor. In this disease, the body's own antibodies hinder the absorption of vitamin B12 by the body. Feeling weak and exhausted, headache, shortness of breath, accelerated heart rate, paleness of the skin, and coldness in the hands and feet are common symptoms of anemia. General symptoms of anemia due to insufficient red blood cells or hemoglobin include feeling tired and fatigued, skin becoming pale, coldness in the hands and feet, shortness of breath and irregular heartbeat even with mild activity, headache, dizziness, nails becoming brittle, inflammation and injuries on the tongue, craving for non-food items, pica syndrome, tingling sensation in the hands and feet, difficulty concentrating, being aggressive and irritable, loss of libido. There are some natural foods that are beneficial for anemia or blood deficiency, especially molasses, tahini halva, dried figs, raisins, red meat, shellfish, chicken, liver, kidneys, and other offal are good for anemia. In addition to these, mulberries, strawberries, bananas, melons, and oranges are among the fruits that help in blood production. Furthermore, folate and vitamin B12 levels can be increased with proper nutrition. If the required amounts cannot be obtained through food, vitamin and mineral supplements can be helpful. Since these supplements can cause medication interactions, they should be used under the supervision of a specialist physician. For vegans or vegetarians who cannot obtain iron and vitamin B12 from animal products, it is recommended to take vitamin and mineral supplements. In cases of anemia resulting from chronic diseases, the underlying chronic condition should be treated. In severe cases of anemia, hospitalization and blood transfusion may be necessary. The decision to proceed with these treatments depends on various factors such as the duration of the anemia, the age of the patient, and their previous medical history. Severe iron deficiency. Anemia can become dangerous in conditions that affect the heart or lungs, such as abnormally rapid heart rate, tachycardia, or heart failure, where the heart cannot pump enough blood to your body. Individuals with anemia may experience weight loss and discomfort. Since oxygen is not efficiently distributed throughout the body in anemia, weight loss may be difficult even with dieting. Common symptoms of anemia include shortness of breath, easy fatigue, weakness, dizziness, difficulty concentrating, headache, brittle nails, hair loss, palpitations, paleness, and fatigue. Anemia-related symptoms such as paleness, difficulty breathing, palpitations, and weakness may be observed. That's all for today. Thank you for listening to me. Please support me by subscribing to my channel and liking the video. Goodbye. Stay well with love.